Hey guys, and welcome back to the channel. Now, I know the last couple episodes that have been on here have been typically different stories that I've ran into thus far in my career. However, the other reason why I'm actually making this channel is because I wanted to put out some knowledge to some of you guys that are just starting out or maybe just have some questions about the field in general. So I kind of wanted to pass that knowledge on to you guys. Some things that I really wish I knew going into the field. Now, typically, depending on where you guys are at, how EMS works in your area, this could be a little bit different. However, if you are in the same area that I am, typically speaking, you either work for a interfacility company that will run the transports between hospitals and some of the 911 BLS things. As an EMT, that's what you'll do. Or you might work for a fire department that runs 911 ALS. Now, obviously, there are some exceptions, like for instance, what I do in the critical care scheme of things. However, we're going to kind of put that aside for now and just talk about the fundamentals. So let's go ahead and dive in. Now, again, guys, this is for those brand new EMTs that are coming out of school. And you might want to actually go ahead and start progressing and moving on in your career. But take a second, stop, don't rush it. Now is the time to get really good at what you do. You have so much to learn right now. The last thing you want to do is rush it and rob yourself of becoming that great EMT. Now, many of you guys are going to want to rush off to paramedic school or fire school or whatever it is you want to do for your career. And while I'm a huge advocate for higher education and bettering oneself and becoming better at what you do, you really need to think about your long-term goals. So, do you want to be a firefighter paramedic? Do you want to be a flight medic? Do you just want to work, as a firefighter for a BLS, non-ALS fire department? What is it that you want to do? So, if you just want to be a firefighter and not run ALS calls and, work, you have a local EMS agency that you guys work with, then you have my full support. Go off to fire school and do your thing. That's great. However, if you want to be an ALS provider and be a paramedic in the field, then guys, this is not the time to be rushing off. This is the time to becoming that great EMT. Guys, you cannot be a good paramedic unless you are a great EMT. I'm going to say that again. You will not be a good paramedic unless you are a great EMT. As a paramedic, you are expected to have a great foundation and understanding of certain things on the scene of a call and with a patient that you're not going to have unless you have a solid background. Well, what are those things? Well, let's go ahead and dive in. Now, guys, I want to make this my first point because I think it is the most important point. If you do not know how to truly and properly assess a patient, you have no right to be treating them at an ALS level. Even if you're in a top tier EMT school, they're still not going to be able to truly show you how to get to a scene, size it up, look at your patients, put your hands on the patients, get your lung sounds, get the rest of your vital signs, on your traumas, doing your head to toes, getting your samples, all these things until you actually do it. It's really important to break this stuff down, guys. Scenario world is only as far as it can go, and you might be the best person in the entire EMT class that did well in scenarios, and you're still going to have issues in the field. Why? Because it's not a controlled environment. You're now in somebody's house. You're now looking at somebody when they're saying that they don't feel well, and you need to figure out why. Guys, I've had the medic student that I put them into a scenario, and and they're getting lung sounds, but they're not putting it in the right spot. And when I ask them why they're doing lung sounds in that particular spot, they didn't realize that they were in the wrong area, guys. Don't be this guy. Don't be this person. By the time you walk into EMT school, you should be really good at assessing your patients and sizing up what you're dealing with before you go into your treatment modalities and your differential diagnosis. For instance, allow me to put you into a situation and see how you would react. You guys get a call for a 44-year-old male and calls 911, says he's having shortness of breath. You get on scene and you find the guy that is tripoding and saying that he can't breathe. His heart rate and his blood pressure is through the roof. What's the next vital sign or the next part of your assessment that you think is the most important? If you said lung sounds, then you're on the right track, because we need to find out if this guy is a cardiac patient or if he's a pulmonary patient. Putting your hands on a patient is a lost art in some places, and I cannot stand it. It doesn't make any sense. You really should be putting your hands on your patient, getting full volume feels, doing your lung sounds. If you have a trauma, do your head to toes. Make sure you get your sample history, all these things, break it down and go through it. It's your job as a detective to find out what's going on with your patient. That way you can act as a paramedic in the future and treat the patient for these issues. As an EMT, you're somewhat limited, but you still can do some things. But that's why it's so important at this part of your career that you're able to fully assess a patient and find out what's actually going on with them, to the best of your ability. I could give you guys hundreds of scenarios, medical, trauma, put you through rigorous days of sim lab training. It's still not going to fully prepare you for the day that you walk into a house and someone's saying that they can't breathe, or when they're screaming out in pain because, for whatever reason, some trauma. Like, until you're put into that position, you really don't know how to act. And, for myself personally, my first time that I walked into a cardiac arrest, I froze. I didn't know what to do. I was kind of just stuck in this limbo until someone directed me elsewhere. Now, thankfully, when I was in this position, I was doing my clinicals with the local fire department. So, thankfully, they knew what to do and they knew how to handle me in that situation. But guys, this has happened to me. It happens to people when they go in their first severe sepsis, when they go on true trauma alerts, all these situations. You might be a deer in the headlights and you might need redirection at that time. But after that initial happening, you typically get better with these things. And when you get onto a scene, just like I would now, if you go into a cardiac arrest, you know it's game time, you know what you can do, you know what you should be doing. So now's the time to ruffle those feathers, get the deer in the headlights look out of your eye, and really get good at what you do. Guys, this is why it's so important for you to be in the position of being a lead EMT on a BLS truck or being the EMT on an ALS truck with a good paramedic that will allow you to do the assessments and take the first look at the patient and then let the medic know what you found. That way you guys can move forward with everything. If it's a good paramedic, they're going to love you for it and they're going to teach you along the way so many things that you don't know yet. However, in the fact that you do end up working with a bad paramedic, they do exist, I'm sorry. Try to get moved off the truck, talk to your supervisor, and see if you can work with someone that's really going to help you in your career. Because that's what's most important, right? So I understand that the somewhat worst part of the job sometimes can be writing a report, because you feel like you're just doing it for billing sometimes. Well, you are doing it for billing, but the other half of the reason for making your report, I see it as for your day in court. Now, I hope that you never have to actually deal with that and go to a court proceeding over a call that you ran. However, it happens to the best of us. It happens to people that even do everything right on the scene. So it's really important that you document appropriately. And this is why it's so important to write reports the right way. Well, what is the right way? Guys, this just means that you hit everything that happened on the call somehow in your report. I'm not saying that you have to do it in some structured 911 format or SOAP or whatever it is that people are teaching these days. For myself, I write it in somewhat of a 911 format that just makes sense to me. And I do the key points of not repeating myself on my reports, taking the time, go through your full assessment, your body survey. Guys, if they have a decubitus ulcer, put it on there. And if you know the stage, put it on there. If you go to a car accident and there is a patient that's complaining of head, neck, and back pain with not a scratch on the car, guys, make sure you're documenting these things. Or if there is a warped steering wheel, put that. Like, these are very important things that you need to be putting into your report. So take the time and get really good at doing this. That way, It's all fluid and easy. Guys, if you try to rush through this, you're going to make mistakes and you're not going to have a good, solid, efficient way of writing your reports. So take the time, do it slow, make sure you're hitting all your points of your bodily survey, make sure you're doing your full history, meds, allergies, everything. Just do it. It makes a lot more sense in the future, and it just reinforces the fact of you being a good provider. Before you know it, your fingers are going to be flying across that keyboard and your reports are going to be done in no time. And in the day that you end up going to court, you're going to have a really good understanding of what happened on that call. Because guys, when you get called into court, this doesn't happen like a couple weeks or months later. Like, it usually happens a year plus out. So you're going to run hundreds of calls in the time between that call happening and you going to court for that call. And you're not going to remember a whole lot about it. So make sure that you document appropriately so you remember everything that happened on that day. Now, I know a lot of you new EMTs are not going to want to work for the private ambulance services because you don't want to do discharges and dialysis all day. Well, guys, what if I told you that these patients are literally some of the sickest patients you'll ever see in your career? Now, I am primarily talking about your dialysis patients because they literally have to go 3 times a week to get the toxins filtered out of their blood because their body can't do it anymore. And if they don't do that, their heart will stop. Now, with enough time in the field, you're going to see what I mean by this. You're going to run your standard dialysis patients that you see every single week. You know what time they're going to finish and everything, or you know what time they're going to get picked up. And you're going to say, oh, I haven't ran that person in a little while. You know, it's been a week or so. And you get there and they look like crap. And they're not wanting to do dialysis, or, you know, they're just being stubborn or whatever it is. And then you're going to be sitting there and you're going to be talking to them and trying to get them to go. To try to get them to go to dialysis so they can feel better. Or you might be taking them to the hospital because they're that sick now. You might even find yourself doing discharges all day. Well, guys, this is a great educational time. You're going to go there and you're going to see the patient, and they're going by ambulance, by stretcher for some reason, right? Typically, maybe they're a fall risk or something like that. Well, are you going to be the average EMT that just writes general weakness and just gets to the call? Or are you going to go and you're going to talk to the patient and dive into their history and find out why they're actually a fall risk? Because that's going to help you down the line. Guys, these are building blocks to make you a great EMT. Now, there are some situations that, you know, the companies that you might work with might have a contract with the local rehabs and the assisted living facilities where they might send a patient out to the hospital, but they might not be sending them out emergently to where the fire department needs to come. The reason why they might want to do that is to keep their numbers down so that they don't have a high rate of 911 calls that go out. So it helps them out on their side, you know, with the state. So in some cases you'll get there and, you know, yeah, they need to go to the hospital, but it's nothing too crazy. So, you know, you'll do everything. You'll take your patient assessment, you know, take care of them and get them to the hospital. However, sometimes you're going to get onto these scenes and these patients are going to be really sick. They might be severely septic from an infection, and instead of calling the paramedics with the fire department or whatever it might be, they called you guys instead because they're trying to keep those numbers down. So this is your time to shine. This is your time to look at your patient, find out what's going on with them, and you're going to make a decision. Either A, we're going to transport this patient because we're closest to the hospital, or B, the hospital is kind of far out, medics are maybe a couple minutes away. Maybe it's best that I go ahead and call ALS so that they can start taking care of this patient immediately. So these are really important things as an EMT, that you're going to be able to triage a patient and find out, like I said, if they're sick, how sick, and if they are, you know, how sick is this patient actually right now. Being in these situations as an EMT on the road, I can tell you that it's a scary situation to be in at first, but it's going to make you a better provider. So put yourself out there, get yourself put into a position as an EMT on a BLS truck where you're the lead, and you're handling these patients and you're having to make those decisions on the scene. Like I said, it's going to make you a better provider. So put yourself there, inject yourself into the position of getting better at what you do, and take care of your freaking patients. This leads me to my next point. We call it practicing medicine, not mastering it. So this is why it's important that you take the time, get your bearings and a good understanding of each position that you're in. That way you don't struggle too much when you progress. A wise man once told me that you can go to school your entire life to kill somebody. And that stuck with me. You know, you could go from EMT school to paramedic school to get your critical care and start flying. But if you don't take the time in each position along the way, a lot of bad things can happen. You know, I've had a time in my career when I was a preceptor and I was training a critical care level medic who just came out of the schooling and is trying to be an active critical care provider for a company I used to work for. And we went up to an ICU floor, and they essentially were sending this patient out for whatever reason, but they had a tracheostomy on a vent, you know, and we walked into the room and the patient had an airway obstruction. I mean, they were struggling to, you know, breathe on their vent because there was this obstruction in their trach. And the critical care level provider that I'm training, they knew that the patient needed to be suctioned, but they didn't know how to do it. They've never done tracheal deep suctioning in their life. And that's something an ALS provider does. So this is one of those situations where had they taken the time to work as an ALS provider and, you know, have that exposure and training and everything that you typically get over time, if they had taken that time to have that, they would have been able to treat that patient accordingly. But instead, they were put into a position that, you know, very well, if we weren't in that position, or, you know, I hadn't checked them off on that, that could have been an issue for them down the road. So that's why it's very important at whatever level of care you're at, you take the time to get really good at what you do and know your skills in each level before you move on to a higher level of care. Now, while that scenario is simply above the scope of practice of any EMT, it's simply just giving you a scenario and a situation that you might be able to adapt to yourself. And what I mean by that is you're always going to do BLS before ALS. So let's take pain management, for instance. You have somebody that has, you know, a leg injury and they need to go to the hospital. Well, have you tried to reposition them, elevate their leg, maybe do a cold compress on them? These are all things that could actually really just alleviate their pain on the site, and they don't need narcotics. So even as a paramedic at my level, I might try to do the BLS things first to see if I can try to alleviate those things before I give them any controlled substances. At the end of the day, like I have no problem treating anybody any way I need to. However, if I can stop from having to put toxins into their body, I will. And any medication is a toxin at the end of the day. So this point for you guys, for me, is be an EMT first. Get good at it. Make your silly mistakes along the way and learn from them. Because these are the things that are ultimately going to make you a good paramedic down the road. Laying the groundwork at this part of your career is so vital and you have so much to learn. The last thing you want to do is miss out. Now, when I worked 911 BLS back in the day, I used to do it with another EMT, and we'd spend time with the local fire department. They would give us lower acuity patients that we can take to the hospital that they were comfortable with us taking, so they weren't tying up one of their rescues that might be needed for a critical or higher acuity patient in the area. So while this makes a whole lot of sense logistically and everything, it does present some challenges as well. The main ones that I knew is either A, The medics on scene might not give you a good, solid, full report and a good understanding of what's going on with your patient, or B, they might give you a patient that is actually pretty sick and would benefit from going with an ALS provider. However, for whatever reason, they're going to have you as a BLS crew take it. Now, this doesn't happen every time, guys, and not every medic's lazy or whatever it is. It's just been my experience when I worked as an EMT. These are some scenarios and situations that I had to be put into. Now, if you're trying to get on with the local fire department, even if it's that department in particular, you might, be doing very well to get yourself known in these positions, because they see your face, they'll see you in the panel. So with this, you might be thinking to yourself, well, if I say I don't want to take the patient because I feel like they could go by an ALS provider, they might not see me as part of the team because, now they're calling another unit because I can't do it. And you think that might make you come off as lazy or just not part of the team or whatever it is. Guys, I want you to not think like this, and you need to change your mindset. At the end of the day, it is your right, and you are taking the responsibility of this patient from an ALS provider down to BLS. So make sure you're comfortable with your patient. Make sure you're comfortable with whatever it is that's going on. So if you don't know something or you're curious about something, ask the questions. Even if you're asking the questions in front of the medic, in front of the patient, that's okay. That's fine, because you are accepting care of this patient now. So it's your job and your responsibility to know everything you possibly can about the scenario. And in the event that, you feel like this patient might do better by an ALS provider, if they're a good medic and they're good at what they do and they care about their patients, then they aren't even going to question this. They're going to say, that's okay. We'll call another unit. No problem. They will respect you more for it if you have a good reason as to why. And this leads me into my next point. Guys, you don't know everything, so stop acting like it. Too often, I am running into scenarios and situations where people will say that they know how to use a medication or they know how to use equipment when they actually don't. Or something that's more relatable to you guys, did you actually hear that blood pressure? Or are you just following the needle in the barometer and trying to take that as your blood pressure? Now, if you're put into this situation and you're being tested off and trained, and your trainer's anything like me, they're going to question you on your responses. And it's not because we're trying to be a jerk. It's because we're trying to stop bad habits before they form and become a normal thing for you. In the medical field, it doesn't matter if you're an EMT or an MD. No one ever wants to admit that they don't know how to do something. And I don't understand it. It's never made sense to me any time in my career, and I have tried to stop it anywhere I've seen it. At the end of the day, if you don't know how to do something or you're not sure of how something works, I can put my salary on it that you're not the only one in the room. So I want to challenge you when you're in these situations, or maybe you're in some sort of an in-service training and you don't quite understand something. If they ask if there's any questions and you have a question, please be that person to raise your hand and say, I didn't quite understand this. Do you mind if we go over it again? Guys, the trainer's going to look at you and respect you for doing that. They want you to come out and be vulnerable and say that you don't know how to do something, because at the end of the day, would you rather right now, yeah, I get it, I know it, I understand, no problem, and then down the line you have a patient and you don't know how to use that equipment and something bad happens, and now you're having the conversation in front of your medical board and they're saying, you've been through this training, you're supposed to be certified in knowing how to do this. Why didn't you know what you were doing? You don't want to be in that position, guys. So take the time, understand what you're doing, understand what you're working with, and how to treat your patients with whatever it is that's in your scope of practice. If you don't know how to do something, whether it's attaching a SAM splint or setting somebody up on a ventilator, make sure you know what you're doing. At the end of the day, if you decide that you want to just get by the skin of your teeth, and you're not learning everything that you could, and you don't know the best way to take care of your patients, well, the only person that's truly suffering is your patient. And I have seen that happen. I have seen the patient be put onto a ventilator on the wrong settings, and them having a hard time breathing because they're not on the correct settings and they're not getting the correct therapy for what they actually need. So these things do happen, guys, and we don't want them to happen. And I don't want that to happen with you. So make sure you're taking the time to learn and understand what it is that you're using and how to do things appropriately. Alright guys, these were just a couple of key concepts that I really wanted to go over with you. Obviously there is so much more content, so much more to know, but we're just going to have to save those for another episode, or else this thing would run for hours. If you have any questions regarding, starting out or whatever it is, as far as when it comes to, being an EMT, please reach out, comment, whatever it is. I'll be sure to give you my unbiased response. Till next time, guys, thank you so much for watching the video. Don't forget to like and subscribe if you are interested in seeing more videos from mine. And till next time, I will see you guys later.